HIV treatment is a pretty big deal. It helps people live longer and healthier lives. So what's in it that makes it so powerful? How does it work? Well, that's what today's science story is all about. From the outside, HIV treatment looks like many other treatments. There's a pill, or maybe a couple of pills you take every day. But there's more than meets the eye. Inside of HIV treatments, there are usually 3 medicines at work. Because research has shown that 3 medicines can help get a person's viral load down to undetectable. And it's been studied and recommended for about 20 years. Undetectable means there's so little virus in the body, it can't be measured by a test. And that's a goal to know about and work toward, especially if you're just starting HIV treatment. Now, the idea to use multiple medicines started when scientists were trying to figure out how to help stop HIV. That's because of how sneaky and single-minded the virus is. HIV has one job, to make copies of itself, and it has a really tricky way of doing it. It attacks your CD4 cells. These are some of the important cells the body needs to actually fight disease. HIV gets into the control centers of these good cells and turns them into virus-making factories. Pretty soon, there's lots and lots of HIV in the body. So scientists looked deep inside the cells to see what was going on and to find out how to deal with it. The virus gets going right away because it has a lot of work to do. Turns out taking over a CD4 cell is complicated. HIV has to go through several steps along the way. So scientists realized that the best way to fight HIV was to go after it in more than one way. And that's what a combination of 3 medicines can do. Here's how it can work inside the body. First, there are a couple of medicines whose job it is to help stop the virus in its tracks before it can take over the CD4 cell's control center. But if HIV does get through, that's when a 3rd medicine can take over and help stop HIV from turning the cell into a virus-making factory. The idea is that 3 medicines can back each other up. Multiple medicines can fight at different points along the virus's path. And that can help shut down the virus factories and keep new ones from starting up. And even though HIV is still in the body, the amount of virus can go down. And less virus in your body means a lower chance of passing HIV on through sex. These fighters don't mess around, and they're ready to go inside the pill or pills you take. Think of the pills as transporters that take the fighters to the virus in your body. So talk to a healthcare provider about starting and sticking to a daily HIV treatment to help get you to undetectable. Because there is no cure for HIV, but when you fight back with HIV treatment, you help protect your health, help protect the people you care about, and help stop the virus.